Hi, I'm Tebbe, and I'm the Ortho and Spine Coordinator at Orlando Health Melbourne Hospital. Thank you for joining me today for your pre-op class on your upcoming knee or hip surgery. The mission of Orlando Health is to improve the health and quality of life of the individuals and the communities that we serve. Let's start with an overview of our total joint program. So I'm the liaison between the patient, the hospital, and the physician. I will oversee the entire patient experience throughout your continuum of care, starting with pre-op preparation like the class we're doing today. My role is to make sure that you're educated and well informed on what to expect. So studies show that the more you know what to expect, the more you're included in your care, the better the outcomes and also the better the patient experience. I will also be working with your discharge planning, making sure that you have your follow-up appointments, your home health care, or your outpatient physical therapy, your post-op prescriptions, and also your walker. So objectives for today's program are understanding your procedure, learning what to expect before, during, and after your stay. We'll talk about pain management, understanding the role of the caregiver, physical and occupational therapy, and we'll talk some more about discharge planning. Your orthopedic team will consist of the orthopedic surgeon, your hospitalist, the registered nurse, the nursing assistant, the physical therapist, the care coordinator, which is like the discharge planner, and of course myself, the orthopedic clinical coordinator. At Orlando Health Melbourne Hospital, our program focuses on the entire patient experience, like I said, starting from the surgeon's office to home. It is data-driven and best practice. It is a collaborative approach, so I work very often with the surgeon's office and also the different departments of the hospital, and our focus is all on best outcomes and best patient satisfaction for you. We focus on wellness rather than sickness, so we don't think of our total hip and total knee patients as sick per se. We just want to get you better and get you out there enjoying those things that you love doing without being in pain. If you do get admitted to our hospital, we have a dedicated orthopedic unit and dedicated and experienced staff for those units. We'll talk about the total knee replacement, the total hip replacement, and also the partial knee replacement. We at Orlando Health do understand that choosing to move forward with surgery is not an easy one to do. It's something that takes a lot of thought and decision making, and by the time that you're here, you've been in enough pain that it's affected your quality of life enough that you've decided to move forward with surgery. So that's why, again, our job is to get you fixed up, get you back out there, enjoying your life, doing things you love to do without being in pain. The total knee replacement is the removal of the damaged bone and cartilage from your thigh bone, your shin bone, and your kneecap with the insertion of an artificial joint or prosthesis, as it shows in the picture. This is just another angle, another way to look at the total knee replacement. And this is the total hip replacement, the removal of the damaged bone and cartilage from your thigh bone and your pelvis with the insertion of an artificial joint or prosthesis. And here's another view that you can look at. Next, we're going to talk about pre-op preparation. So you should have all gotten a guidebook. There's a lot of really good information in the guidebook, so make sure that you are familiar with that information. Particularly look at your pre-op exercises. So remember, when your joint is weak, the muscles around your joint also tend to be weak, so you really want to strengthen these up as much as possible prior to surgery. This will really help in your recovery after surgery as well. Also look at what we call the circulation exercises. So those are your ankle pumps, your quad presses, your butt squeezes. These can be done as soon after surgery as possible. So even if you're in the recovery area and you remember me saying to do these pre-op exercises, go ahead and do a few sets. You can do them while you're sitting or laying in bed as well. So these exercises will just get your blood circulating, helping in the recovery for your surgery and also to prevent things like blood clots from occurring. So now let's talk about the caregiver selection. So everybody has to have a coach or a caregiver. So this is a person that's going to help you after surgery. So we do want somebody to be with you for at least the first 24 hours. This way they can help you with little things like maybe cooking for you or getting the things you need, or at the very least just to be that extra set of eyes to make sure that you're doing okay. So everybody really needs to have a caregiver. So start thinking about who that's going to be. When you're preparing for surgery, you should make sure that any clearances for your primary care or cardiology are provided to your surgeon prior to surgery. Know your insurance benefits. You need to know what your copays are, your deductibles, your copay for your equipment and your medication. Make sure that you set up transportation with your family or friends, your caregiver, prior to surgery. So we need someone to drop you off the morning, or if they want to stay with you, that's good, and we have to have somebody to pick you up. If you live alone, just remember that insurances don't consider this a reason for you to go to a rehab or a skilled nursing facility. So definitely discuss this with your surgeon if that is an issue. So you should also know whether you'll be using outpatient or home health care after surgery for your physical therapy needs. These should be addressed in your surgeon's office. You will also have at least 2 prescriptions. You'll have something for pain and also a blood thinner. So after surgery, make sure that you have either aspirin 81 milligrams, aspirin 325, or Xarelto. If you're already on a blood thinner like Plavix or Eliquis, you'll just resume that. And this is just to prevent blood clots. And you'll want to stop any over-counter vitamins like herbal supplements, anti-inflammatories, or NSAIDs. So this is your Motrin, your Advil, your multivitamin. You want to stop these 7 to 10 days prior to surgery. And this is because all those medications I just mentioned do have blood thinning components in them, and we don't want that to interfere with all the medications we'll be giving you the morning of surgery that also have blood thinning components in them. You want to stop any GLP-1 agonists, so those are your Wegovy, your Mounjaro, known as your weight loss medications. We definitely want to stop those 7 days prior to surgery. If you're on phentermine, that's another weight loss one. You want to stop that 5 days prior. Make sure you get your pre-op labs done, including your MRSA swab. So the only piece of equipment that you're going to need to have is the rolling walker, and that's the one with the 2 wheels in front. So we do ask that you have that prior to surgery and that you bring that in. Some other pieces of equipment that you might want to get are your 3-in-1 commode or your shower chair. Just make sure that your insurance covers those. The other thing that you may want to get is your hip kit. So these things just help you for after surgery. So there's the long-handled sponge that you can get your back. There's also the long-handled shoehorn. There's also what we call the sock aid. So the sock aid, and I'll talk about these in a few slides. These are your TED hose, and these provide circulation to promote blood flow to prevent blood clots from occurring. Our surgeons do want you to wear these for about 4 weeks after surgery. The only thing is they can be a little bit difficult to get on and off. So then make sure you have this all the way up. And then you could stick your leg in there and then just pull on the rope, and then it'll be on your leg. So this is just one of the things that you can use to help you out with your surgery. And then you'll need to get your chlorhexidine gluconate shower. So you can pick this up at the security desk at the front of the hospital, or it can be purchased at any local pharmacy, so Walgreens, CVS, anywhere like that. We want you to wash with this soap a total of 3 times prior to surgery. So you'll wash with it 2 days before surgery, day before surgery, and morning of surgery. What I would recommend you do is go ahead and wash with your regular shampoo and your regular soap first. Wash from your neck and down, not in your face, not in your privates. Don't get it on anywhere that's sensitive, because this can be very drying, and we definitely don't want to irritate those sensitive areas. Also, there's no shaving your legs or armpits for 48 hours prior to surgery. We don't want you to get any cuts or abrasions. Sometimes you could get micro abrasions that we can't see, but that can allow microorganisms in. So very important to not do that. Preparing your home. So start thinking about your home, where you're going to sit. Chairs with armrests are good because they help you get up and down. Recliner chairs are okay because you can put the bottom up, you can elevate your legs, you can do your circulation exercises when you're on there. Remove any throw rugs or any extension cords that might be a tripping hazard. I would recommend using a night light in your bedrooms. So this way, if you have to get up to use the bathroom in the middle of the night, you can see clearly where you're going with the walker. Make sure that you have a clear path around all your pieces of furniture, so you don't want to be running into things. So if you need to move your furniture apart a little bit to create bigger spaces for you and your walker, please go ahead and do that. If you need to prepare meals and freeze them, go ahead and do that. Also, if you have any pets, make sure you arrange for someone else to take care of them. You definitely don't want to have any tripping hazards or any accidents with any pets. And also remember that good preparation leads to a great outcome. So your body will undergo some stress with this surgery, and now is the time to prepare. In the same way an athlete would prepare for a marathon, you should prepare your body for surgery. Preparation will include a healthy diet, hydration, exercise, smoking cessation, and if you have diabetes, managing your diabetes. Let's start talking about a healthy diet. Good nutrition is essential to a good outcome. Sometimes after surgery, you may not be very hungry, so you really want to make sure that you pick items that are healthy. Make sure that you have items that are high in protein, eggs, nut butters, beans, meats. This will really help with your wound healing. Hydration is also very important. Stay well hydrated before and after surgery by drinking at least 8 to 10 glasses of non-caffeinated fluid such as water. So studies show that smoking reduces the blood supply to the bones, the muscles, joints, and other tissues in the body. Not only does it slow the healing, but it also will increase the risk of surgical site infections, and you're at a higher risk for developing blood clots. So we definitely want you to stop smoking prior to surgery. And actually, the surgeons will ask to test for nicotine in your blood, and if it is positive, it may result in a delay for your surgery. So if you're in the process of quitting smoking or using any nicotine products, make sure you let your surgeon know, and we can give you some resources to help you with that. Diabetes also increases your risk for developing infection and complications after surgery. So very important if you are a diabetic to make sure that that is well managed and keep your blood sugars well under control. So pre-admission testing, the pre-admission testing nurse will call you 3 to 5 days prior to surgery. They're going to go over your health history, your medication history, ask if you have any advance directives or living wills, and depending on the amount of your health history and the amount of medications you're on, it can be a pretty lengthy call, anywhere from 30 to 45 minutes. Your surgery schedule time, the nurses will call you the day before surgery. So if you're having surgery on Monday, they'll call you on Friday. They'll give you the time for surgery, remind you that there's nothing to eat or drink after midnight. The only exception to that is if that pre-op nurse that called you that prior to surgery tells you that there's some medications that you can take the morning of. And if they do let you know, then you're going to take those with small sips of water. They'll also remind you to bring in your advance directives if you have any, and also to bring your walker in. What I want you to bring to the hospital are comfortable, loose-fitting clothing, shorts, t-shirts, sweatpants, nightgowns. If you have sleep apnea, make sure you bring your CPAP machine in, because we will use that after surgery. Also, if you have any glasses, dentures, any personal aids, make sure you bring those in. You can leave your valuables at home, so any jewelry or cash, don't bring those in. You don't need to bring in any medications. So all those medications you picked up for after surgery, go ahead and leave those at home. We won't be using that here. We have all the medications that we need here to provide for you. The only exception to that is if you use any inhalers or you use any specialty eye drops. So if you use any of those two things, then make sure you also bring those in. And no flip-flops. We want shoes that have a closed toe and a closed back, and also a non-skid bottom. So this is just to protect you. We don't want any accidents after surgery. So we did have a patient that one time put on flip-flops to go home. They fell, injured themselves again, and had to go back for surgery. So this is just for your safety. So the morning of surgery, there's going to be nothing to eat or drink after midnight, except for the approved medications that the pre-admission testing nurse gave you. And if they did give you something, then you're going to take that, remember, with small sips of water. You're going to take your final CHG bath, no lotions, powders, colognes, or perfume or deodorant, please. You'll check in with the security guard and they'll show you where to register for surgery. Once you're done registering for surgery, then they'll show you where to wait for the pre-op nurse to come and take you back to prepare you. Once that pre-op nurse takes you back to prepare you, your coaches have to wait outside in that waiting area. It'll take anywhere from 30 to 45 minutes, but once they're done, they will come and get your coaches or your caregivers and they can come stay with you in that pre-op area until you're actually rolled out for surgery. So once the nurse comes to get you, they're going to change you into a gown. They're going to give you what we call the nose to toes program, and this consists of, you'll have some wipes with that same chlorhexidine gluconate soap, and you'll go ahead and wipe down with that. So you'll have one package for your left arm, one for your right. The nurses will give you instructions on that. There's also antimicrobial mouthwash that you're going to brush your teeth with. There's a sponge that you'll sponge around your gums with. You'll gargle and spit out with the rest. And then there's also a nasal swab, a povidone iodine nasal swab that they'll put in your nose. And this is all for infection purposes. Again, we call it our nose to toes program. The surgeon will also speak to you here. So if you have any last minute questions or concerns, make sure that you ask them. You'll also meet your anesthesia team here. They'll review your health and medication history. They'll discuss any nausea or pain medication concerns you may have, and they'll discuss the type of anesthesia that they're going to use. So definitely, if you've gotten nauseous with anesthesia before, that's something that you want to let them know. If you've had any complications with anesthesia, very important to let our anesthesia team know. The two types of anesthesia they'll be discussing with you is the general anesthesia. That's the one where they give you anesthesia that's inhaled with IV sedation medications and intubation. If you've had this type of anesthesia, when you wake up, you'll probably be very groggy, have a sore throat. The other type of anesthesia is the regional anesthesia. So that's where you get a block and you still get medication in your IV, so you are not awake for this. When you wake up from this, you may have numbness or difficulty moving your lower extremities for a couple of hours, but then you'll be able to regain that after some time. So the gold standard for this type of surgery from our anesthesiologists and also from our surgeon is the regional anesthesia. And there's a couple reasons for this. One, you wake up sooner, you're more able to participate with physical therapy sooner, but the most important reason is that it doesn't have as many risks or complications as with general anesthesia. But our anesthesiology team is wonderful, so make sure you get all your questions answered, and they will take, if you have a strong preference, into consideration as well. The other thing we'll do in our pre-op area is the nurses are going to teach you how to use the incentive spirometer. So if you've ever had surgery, I know you've seen a device like this. After surgery, you're laying around, you're sitting, you're just not moving like you normally do. So we're not expanding our lungs like we normally do, and we can get what we call a post-operative pneumonia. So that might include a low-grade fever or a cough. So this device just reminds you to take those nice deep breaths, and it gives you a nice visual of how you're doing as well. So I'll go ahead and demonstrate. You want to make sure that you have the tube all the way extended out, and you're going to take a nice deep inhale. I'm going to show you, there's two discs in here. There's a bigger blue disc, and we'll measure how far you're able to get that disc up to. But in the meantime, there's a small disc over here, and you're going to try to, as you're getting this disc up, maintain the small disc in between the two lines. And they will discuss this with you and show you how to do this the morning of surgery too, but I will give you a demonstration. So I don't know if you were able to see that I did try to keep this in between the two arrows. So that just ensures that you have a nice slow deep breath rather than quick breaths. So our surgeons do recommend you use this 10 times an hour while you're awake. I wouldn't use them all 10 times at once because you don't want to get lightheaded or dizzy. But if you're watching TV and the commercials come on, I would do them every time the commercials come on 3 or 4 times. Anytime my patients have a low-grade fever, this is the first thing I grab. So I always tell them, you must not be using this enough. Make sure we're using it 10 times an hour while you're awake. The other thing that they'll be putting on are your TED hose. Your TED hose are also known as your anti-embolism stockings, and these are very important. They're nice and tight, and they're supposed to be tight to promote circulation. So again, after surgery, you're not moving, you're not walking like you normally do, so you're sitting around and it's not circulating your blood like normal. So you are at a higher risk for getting blood clots. So these TED hose or anti-embolism stockings just help to prevent that. So they will put these on you in the pre-op area, and the surgeons do want you to wear these for 4 weeks after surgery. You can take them off at night and when you shower, but very important to wear these for 4 weeks. The other thing that you'll get on are what we call the SCDs, or the sequential compression devices, and these are only for hospital use, so you don't have to use these at home. But again, they wrap around your calf on top of your TED hose, and it's going to plug into a machine at the end of your bed that runs on electricity, and it's just going to gently inflate and deflate, inflate and deflate. Again, the same premises to promote circulation, to prevent blood clots from occurring. But like I said, these are only for hospital use. Some patients do ask though, like, can we get these for when we go home? So they do sell them, places like Amazon or some DME companies like Brownings. You can call and see if they have these, but they're battery operated. And if you do decide to get those, then you can wear them really like when you're sitting or laying, and even if you're walking around, because they're battery operated, you're able to get up and move around with them on. So it's just an extra protection above and beyond. Next, you'll go to the operating room. You'll be here anywhere from 1 to 2 hours. After that, you'll go to the recovery room. You can anticipate being in the recovery room about 1 to 2 hours as well. You may feel cold and have a dry mouth from anesthesia, depending on what kind of anesthesia you use. You may have a sore throat as well. Remember, from intubating, if you've had general anesthesia. If you've had that regional anesthesia, remember your legs may feel numb, and that's normal. That'll go away after a couple of hours. Doesn't matter what kind of anesthesia you have though, we'll be monitoring you frequently, so frequent vital signs. You'll be hooked up to the blood pressure cuff and also have the pulse ox on your finger measuring your oxygenation levels. You'll have a couple liters of oxygen going to your nasal cannula. You'll have IV fluids going to your IV. Also, the nurse will monitor any discomfort that you may have. Your surgeon is going to definitely order an x-ray, so I'd like everybody to know that, because they like to check for placement of that prosthesis. And this is also where you're going to be getting your ice packs. So these will be placed on your incision area right in the recovery room. And these nice little ice packs are going to go home with you. So every one of these sleeves, and I'll show you, has 2 compartments, and each compartment fits 1 ice pack. So each of these sleeves fits 2 ice packs, and you get to take your sleeve home, and you will also get 4 ice packs to take home with you. So remember, ice is going to be your best friend after surgery. So you can use these ice packs as often as you want. They're actually specially designed so you don't have to worry about the 20 minutes on, 20 minutes off. You're going to leave them on, and they'll usually last anywhere from 2 to 3 hours. The only thing I ask is don't let it get warm or hot. So ice is supposed to help with swelling, the coldness. If it gets warm or hot, the opposite will happen. You'll have more blood flow, more swelling, and more discomfort. So make sure that you use these ice packs and that you don't allow them to get warm. Surgical dressings afterwards. A lot of our surgeons will use the Aquacel dressing or the Mepilex dressing. So both of these are water resistant, which means you can take a shower after surgery, which is really nice. It is the protection between the external environment and your incision. So we do ask that you keep this on for the first 7 days until either your first post-op visit or the home health care nurse comes to remove it. So this was put on in a sterile environment, so we don't want to take it off and look underneath and look at what that incision looks like. We want it to stay on for at least that first 7 to 10 days. And again, it will be removed at your first post-op visit or when home health care comes to remove that. Underneath, you'll either have a perineo-derma bond, which is the mesh with the skin glue over top, or you might have staples, or you might just have the derma bond, which is the glue itself. So remember, if you have this Aquacel dressing on, Even though you can take a shower, you still cannot submerge in any body of water. So there's no swimming, there's no hot tubs, no going in the ocean, and that's usually for about 6 to 8 weeks. So we want to make sure that that incision is completely healed before we submerge in any body of water. We definitely don't want to get any microorganisms in there. So that's why we ask that. So one of two things are going to happen after surgery. You'll either go to phase 2 and go home same day, or if you're an inpatient, you'll be coming upstairs to the orthopedic unit. If you are going to go home, you do have to meet strict requirements in order to be discharged. Your vital signs have to be stable, your dressing dry and intact, no active nausea or vomiting. Physical therapy does have to see you and clear you as safe to go home, and you have to be able to urinate. We do give you a nice long time after surgery though to meet those requirements. So usually after your recovery area, which is the PACU, you'll be there about an hour or 2, then you'll be transferred to phase 2, and you can be there anywhere from 3 to 6 hours. At the end of that 6 hours, if you haven't met one of those requirements, then the nurse can call the surgeon and we can bring you up under observation. For our knee patients, you are going to have a ACE wrap bandage wrapped around your knee, and that stays on for the first 24 hours. It can be removed the next morning, either by you and your caregiver at home, or if you're on the orthopedic unit, we will remove that for you. Again, you will have those ice packs around your incision to help you with swelling and help with discomfort. And also we'll be asking quite often what your pain level is. So even before surgery, we'll be asking you about your pain. So what is your pain level on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever had? So we want you to set an acceptable pain goal. We understand that people have different pain tolerances and different pain levels. Some people have been in pain management for a long time, and if you have, that's something you really want to let your surgeon know, as well as the nursing staff when they're taking care of you. So set an acceptable pain goal. So your pain goal will be one that you can eat, you can sleep, you can be pretty comfortable doing your circulation exercises and working with therapy. Most people, if they set it at a 4 or 5, then if it goes above a 4 or a 5, we want you to get something for pain. There are no gold stars for holding out on pain medication after surgery. Let me repeat that. There's no gold stars for holding out on pain medication after surgery. So it is very important that we stay on top of your pain, intercept the pain when it starts, ask for medication, don't wait. Because if you wait, the next thing you know, you're gonna be up at a 9 or a 10. And once you're up at a 9 or a 10, a couple of things happens. One, it takes a long time to get back down to your acceptable pain level of a 3 or a 4. And the other thing is you don't wanna move. So you don't want to move because every time you move, that's when it hurts. And that's the opposite of what our program and our surgeons are promoting. So we want you up, moving around, probably about 4 hours after surgery is what we're aiming for. So we don't want you just laying in bed in pain. So if you need to, take your pain medication on a regular basis. So it's normally written every 4 hours. So at the end of 4 hours, start rating your pain. If at that time it's a 8, 9, or a 10, you're going to take something. If it's only a 1, 2, or a 3, you may say, you know, I don't need anything right now, but I will reevaluate in another hour or so. Make sure you let the nurse know or your surgeon know if the pain medication isn't working, because we can always add things or change things up. And make sure you understand the pain management efforts that are in place. Always be your best advocate and know what's going on in your care, not only for pain, but in every avenue. Types of discomfort, obviously incisional, soreness or pressure, discomfort from your swelling or bruising, and if swelling or bruising is going to occur, it'll occur in days 3 through 10 will really be when you see that. So I let you know that because I don't want you to get home and become really worried because you have swelling and bruising. That's actually the time frame that you'll see that swelling and bruising after we've caused injury to our body, either accidentally or on purpose, like with surgery. Also, you might have some thigh pain as well, and that's usually for your total knee surgeries. And that's because during surgery, they've had to put a tourniquet on your thigh and pump it up really, really tight to stop that blood flow to your knee. So a lot of our patients after a total knee will complain of thigh pain as well. And so you can also put ice on that to manage. So there's a variety of methods used to help you with your pain. They can use nerve blocks or Exparel. So Exparel is tiny injections of bupivacaine into the tissue surrounding your incision. They'll use IV pain medication, morphine or Dilaudid. We have oral medications as well for pain, such as Percocet, which is oxycodone with Tylenol, or hydrocodone with Tylenol. The doctor may order nonsteroidal anti-inflammatories for you, such as Celebrex or Meloxicam, and those are your high-dose anti-inflammatories. So if they do order that for you, make sure you're not taking additional anti-inflammatories like ibuprofen. Also remember, we'll be giving you the ice cold packs for you to help with pain as well as the swelling, and also relaxation techniques are something that you can use, like meditation and music. Please know that we can't make the pain go away completely, but we do aim to manage the discomfort so that you can eat, sleep, and move around pretty comfortably. Post-op activity day and surgery day, we've talked about all of these already. So these are your circulation exercises, your ankle pumps, your butt squeezes, your quad presses. You'll have your SCD machine, remember, that's inflating and deflating. You'll have your incentive spirometer, remember, that we want you to use 10 times an hour while you're awake. And again, we're going to want you out of the bed, in a chair, and walking with your walker for probably 4 hours after surgery. Physical therapy will evaluate you to see if you can ambulate safety for discharge home. They'll teach you how to get in and out of the bed, in and out of the chair, and how to walk with the walker as well. So if you're going home same day, you'll need to see physical therapy, and they have to clear you for going home as well. So everyone's going to have joint precautions. So if you're having a hip done, you're going to have either the posterior or the anterior precautions. And really that's going to depend on where your incision is. So if it's in the front, that's considered an anterior approach. And if it's in the back, that's considered a posterior approach. And then you may also have a lateral, which is on the side. If you're having a knee, it's pretty easy. The only things you can't do is a figure 4 position where you're crossing your legs like crisscross, and you do not want to put a pillow under your knee. So if you put a pillow under your knee, scar tissue starts forming right away because it's a small joint, and you don't want to form while your knee is bent. You do need to extend your leg fully in order to walk. So I've heard the surgeons say it's like a race against time between you getting your range of motion back and getting scar tissue. So very important not to put anything under your knee. With that said, even though you don't want to put anything under your knee for long periods of time, like when you're sleeping, it's still going to be important that you extend or straighten or flex or bend your knee. So that's going to be very important for you to get your range of motion back. The anterior hip approach, so this just gives you a picture of what that looks like. There's going to be no hip extension, no external rotation, and this approach is less likely for dislocation because they're not cutting through any of the muscle. Once again, please review this with your surgeon and also with your physical therapist after surgery. Posterior approach, so this is the one, remember, where they cut through your back. So they're cutting through muscles. So this has stricter restrictions. You can't bend past 90 degrees. There's no internal rotation and no adduction. For these types of surgeries, you may have a pillow, a pink foam pillow that goes in between your legs when you're sleeping after surgery to prevent them from adducting. Sometimes if they even don't have that big pink pillow, they may have just a little pillow just to remind you not to put your legs together. For the lateral approach, it's very similar to the posterior approach. So there's no hip flexion greater than 90 degrees, no external rotation, and no adduction. Again, these are definitely more dangerous in combination. So your physical therapist will review these with you in great length after your surgery. Safety, so all of our patients are at a risk for falls precaution. It's because you just had surgery, right? So when you're sitting or laying down, sometimes you can feel pretty good, but when you get up, especially that first time, you might get lightheaded or dizzy. And remember, you're not used to walking with your new walker. So we just want you to call before you get out of bed, and this way, if something does happen, we'll be within arm's reach so we can escort you either back to the chair or back to the bed without any issues occurring. Also, everybody should be washing their hands before they come in and out of your room, not with the normal soap and water, then definitely with the hand sanitizers that are located all throughout the rooms and throughout the hospital, especially if they're coming near your dressing or giving you something in your IV or medications, and you can ask them to do that. Be your best advocate again. If you see somebody and they haven't done that, feel comfortable asking them to please, can you clean your hands before? So if you're admitted to the hospital, the day after surgery is what we call post-op day 1, and this can begin as early as 4 a.m. So our night shift nurses are responsible for this. So we want to get you washed, cleaned up. If you're a knee patient and you have that ACE wrap dressing on, we'll go ahead and remove that, get you dressed in the recliner, and ready for your day to begin. So other things that may happen the day after surgery is you'll get some blood work done. Your surgeon or your surgeon's nurse practitioner or physician's assistant will round on you to see how you're doing. We'll have our care team come see you. Our home health or our outpatient services will make sure that we have those situated for you. And again, physical therapy is going to see you. They'll review your precautions. You should anticipate a discharge to home. Preventing post-op complications is a huge thing for us, for all of us. We can look back historically at these types of surgeries and then what complications happen with these types of surgeries, and then we can look at to best practice as to preventing those. And that's what we've done for our blood clots and pulmonary embolus, pneumonia, infections, and also constipation. So for blood clots, which are also called DVTs or our PEs. So PEs are a blood clot that has started in your leg and maybe has traveled through your bloodstream and gotten stuck in your lungs. Signs and symptoms of those, you'll have increased pain and tenderness in your leg. You may have swelling or warmth. So if you have a PE, it'll be pretty obvious. You'll have some shortness of breath, you may cough up blood, chest pain, painful breathing. These are symptoms that you definitely want to report to your surgeon right away. And we prevent them by all the things we've already discussed, such as your blood thinners after surgery, your sequential compression devices or your TED hose, and definitely activities. So getting up and walking is very important. Pneumonia, again, all the things we've discussed to prevent this, definitely using your incentive spirometer 10 times an hour after surgery. There's also some coughing and deep breathing exercises in your guidebook as well. Make sure you get enough sleep and exercise and have a healthy diet to keep your immune system strong. Remember, there's no smoking, so if you were smoking prior to surgery and quit, make sure it's important to continue that even after surgery. And again, ambulation and walking around will help prevent pneumonia. Infection, so definitely we've talked about a few of these things already. Your hand hygiene is the #1 way to prevent infections. Also, all of you will be getting some antibiotics. So your first dose of IV antibiotics will be in the surgery itself. You will not go home on any oral antibiotics. Studies don't show that helps any to prevent infections. Also remember, we give you that special dressing that stays on for about 7 days after surgery. So that is a barrier between the external environment and your incision. Not smoking, making a healthy diet, and also making sure that your home environment once you're discharged is clean. We want to make sure it doesn't have a lot of clutter so you're not going to fall or trip. You're going to make sure your linen and your pajamas are cleaned, mindful of your pets, so you want to make sure that they're not coming near your incision or licking your incision. Also, when you are going near your incision, you're going to make sure that you wash your hands. Constipation can happen after surgery, especially with our pain medications. So what I would recommend is that you go ahead and buy your over-counter stool softeners, so your Colace, your Miralax. If you come up to the hospital, if you come up to the orthopedic unit, we actually start with the Colace 100 milligrams twice a day along with the Miralax. So I would definitely mirror that if you're going home. Don't wait for you to have any issues with constipation. Let's go ahead and prevent those ahead of time. On your discharge from the hospital, you'll be getting specific discharge instructions that the nurse will review with you that goes over all the things we've already mentioned, so that you'll be going home with the walker, your physical therapy and what they recommended, your incision and how to manage your incision. So don't add any creams or ointments to your incision. Remember that this may increase your risk of an infection. So do more activity each day. Go ahead and you're going to follow how your body feels though, so don't overdo. If you're feeling tired, make sure you take rest periods and discuss with your surgeon when to return to work or resume exercising or driving. Caring for yourself once you're at home, you're going to change positions often, so I want you to get up every hour to hour and a half while you're awake. I don't want you to sit for long lengths of time. It's going to be very important for you to get up and walk with your walker. You don't have to walk a marathon, but even if you can get up and walk to your kitchen and back or the bathroom and back, I do count that. Follow your joint precautions strictly. So remember, the reasons we have those in place are because right after surgery, you're at the highest risk of dislocation. So usually these restrictions will be in place for the first 3 to 4 months, but make sure you speak to your surgeon about when you can start doing more and more things. Walk daily and steadily and increase your distance as you can. Pearls of recovery, pick one day a week to measure your progress. I say that because I don't want you to get discouraged if you measure in terms of day to day. One day you may do really well and the next day you may be exhausted, and that's very normal. Do your exercises regularly like we talked about. Eat healthy. Remember, you might not be very hungry after surgery, so make sure that the food you choose is nutritious and high in protein. And again, no smoking. So smoking really decreases your healing and also puts you at an increased risk for all sorts of complications. So definitely no smoking. Medications, take your pain medication regularly as described. Speak to your surgeon about when to decrease or discontinue your pain medicine. Take your stool softeners like we talked about, and resume your pre-op medications as instructed. Appointments, if you have any dental work or any procedures, we don't want you to do those up to 3 months after surgery. So if you're going to do them before surgery, make sure you do them at least 6 weeks prior to surgery. And if you do have any after surgery, even after 3 months, even if you have a dental cleaning, you may need to be on some pre-op antibiotics. So one of two things are going to happen. Either the dentist themselves or the provider that's doing the procedure will order you those antibiotics, or you're going to call your surgeon and let them know you're having this procedure done, and they'll go ahead and call in your antibiotics. So you will have a post-op appointment, and your discharge nurse will go over when that is. Also make sure that you get a primary care appointment, and usually we like you to see them within 1 to 2 weeks after surgery. Discharged to home, you can sit in the front seat of your own vehicle. You can push the seat all the way back, and this way you can extend your legs out. If you do have a long ride or if you become uncomfortable, just stop and get out and ambulate with your walker. Thank you for choosing Orlando Health Melbourne Hospital to have your surgery. If you have any questions, please feel free to reach out.